Welcome. Millions of people became addicted to a pill their doctors were told was completely safe, and the company behind it insisted there was almost no risk at all. A billionaire family helped create one of the deadliest drug epidemics in modern history. Their name was carved onto museums, printed on university walls, celebrated by the world's elite. But while their reputation was being polished in public, millions of people were quietly becoming addicted to a pill they insisted was safe. And by the time anyone understood the truth, it was already too late. In 1996, a pharmaceutical company called Purdue launched a new painkiller, OxyContin. It was powerful, fast-acting, chemically similar to heroin, but Purdue told doctors something revolutionary. Because of its slow-release formula, patients were unlikely to become addicted. It sounded like a medical breakthrough, a powerful opioid with almost none of the usual risk. Doctors believed it, and that belief changed everything. Purdue didn't just release the drug. They built an army to sell it. Thousands of sales reps were sent across America. They visited clinics, hospitals, private practices. Doctors who prescribed more pills were rewarded with paid trips, bonuses, and expensive dinners. Every prescription meant profit. And inside Purdue, one message was repeated constantly: push higher doses, because stronger pills meant larger profits. And larger profits meant the Sackler family became richer than ever. Then something strange started happening. Patients who had followed every medical instruction began showing signs of addiction. Some said the relief faded too quickly. Others needed larger and larger doses. Many crushed the pills to bypass the slow-release coating entirely, getting an instant high. Reports started flooding in. Overdoses increased. Doctors raised concerns. Entire towns were beginning to change, and Purdue knew. Internal reports showed abuse was rising fast, but instead of slowing down, the company blamed patients and doubled down on marketing. What happened next was catastrophic. Millions of prescriptions flooded small towns across America. Places with only a few thousand residents were receiving millions of opioid pills. Communities collapsed almost overnight. Parents disappeared into addiction. Children were left behind. Hospitals filled with overdose victims. And while families buried loved ones, the Sacklers remained untouchable. Their names appeared on museum wings and elite universities across the world. To the public, they looked like philanthropists, not the architects of a national crisis. Eventually, investigators started asking questions. Journalists uncovered internal emails. Court documents exposed aggressive sales tactics. Evidence showed Purdue had continued pushing OxyContin long after addiction risks were obvious. The family denied responsibility. They insisted they had done nothing wrong, and legally, for years, they were mostly protected. That was the terrifying part. This wasn't some criminal empire hiding in the shadows. It was operating in daylight, protected by lawyers, regulators, and corporate language. When lawsuits finally arrived, the damage was already irreversible. Museums quietly removed the Sackler name. Their public image collapsed, but reputations are easier to erase than consequences. Because by then, hundreds of thousands of people were dead. And millions more had already been pulled into addiction, all because one family discovered something terrifyingly simple. If you can convince people a dangerous lie is medicine, they'll swallow it willingly. The opioid crisis wasn't caused by one bad decision. It was built carefully, meeting by meeting, prescription by prescription, until addiction became one of the most profitable businesses in America. Please like and subscribe for more short summaries.